Meniere's disease was described by Prosper Meniere back in 1861. In his classical description, the condition arises because there is increase in the fluid pressure within these two organs, your organ of hearing and your organ of balance. Because of that, what the patient suffers is severe ringing in the ear, which we call tinnitus, as well as severe dizziness and vertigo, so bad that he actually cannot stand up, falls to the floor, sees the room turning, and starts to vomit. All of this will last no more than 24 hours, after which the pressure in the ear dissipates and the patient returns to normal. That is the classical Meniere's disease description. Meniere's disease is usually diagnosed by taking a good history of the account of attacks that the patient has at every episode. It also becomes more obvious if the patient has repeated similar attacks. In terms of investigations, some of the investigations, like hearing tests, are quite straightforward to do, and they may classically show a low-tone sensory neural hearing loss. But other tests, which are used to confirm Meniere's disease, they're a bit more invasive, like the electrocochleogram, where a needle is required to be inserted through the eardrum onto the inside of this organ to measure the electrical potentials. Is there any cure? Unfortunately, to this day, there remains no ultimate cure. Meniere's disease is a severe condition for those who do suffer from it. It is unpredictable. Patients get severe dizziness, hearing problems, and vertigo and nausea and vomiting. The conditions when you will tend to get it more is particularly when you do not have enough rest, if you take more salt in your diet. Salt has an effect for a very simple reason that where salt goes, water follows. And therefore, the Meniere's disease, which is due to a buildup of pressure within the system, is more likely to occur with a high salt diet. Managing the acute attacks of Meniere's disease is very difficult. The patient is vomiting, so he really needs to take tablets which reduce vomiting. That may not be possible. He swallows the tablets and he vomits it out. The patient is dizzy. He needs to take the anti-dizzy tablets. Again, that may not be possible because he will vomit out the same tablet. So usually, in the very severe attacks, Meniere's patients often find that they have to be admitted to hospital, where intravenous or intramuscular injections of anti-dizzy tablets will help better. However, the good news is that not all attacks are quite that severe, and often patients have what we call a prodrome of sensation to tell them that an attack is imminent, and usually that gives them enough time to make sure that they take some medication beforehand.
Fine Doc, your doctor is here.